Welcome to the show, Dr. Dodell.
Thank you.
So, Dr. Dodell, you're a proponent of health at every size approach in healthcare. So, explain what that means to people out there.
It means that people can be healthy across the size spectrum. Simple as that. I mean, the statistics about 70% of women, 50% of men want to change their weight. It's just heartbreaking. I see it all the time in my patients who have told me they've been in doctor's appointments, they've left crying in tears. And, to me, that's heartbreaking because then they avoid going back for appointments and preventative medicine. And I think that's really the issue here. And I really choose, and I think we should be focusing on health promoting behaviors like sleep and stress management and all the things with mental health and joyful movement, which can happen across the size spectrum.
And according to your theory, work with that and other things are going to happen as a result of your approach.
Totally. I mean, weight is not a behavior, right? Behaviors are movement, it's nutrition, it's working with our stress. Weight may change as a result of those things, or it may not. It may stay the same. Look, if I see a patient who has uncontrolled type 2 diabetes and we get the diabetes under control, they may actually gain weight. They may gain muscle. So, and the number on the scale is not a reliable indicator of health in and of itself.
Ragen, give us some examples of the inequality overweight people face in healthcare.
Yeah, so these inequalities hit at every level. So it starts with research. Often research doesn't include higher weight folks. And so the pharmaceuticals and best practices and techniques and tools that are produced don't work as well on higher weight folks. Then we have lack of accommodation, and that's everything from not having a chair in the waiting room that accommodates you to not being able to get an MRI or another diagnostic test to surgical tools and durable medical equipment. And then we have practitioner bias, and research shows that over 50% of doctors find their fat patients, quote, awkward, ugly, weak-willed, and unlikely to comply with treatment. And 30% of nurses are, quote, repulsed by their quote-unquote obese patients. And so what we've got here is kind of a vicious cycle where our current paradigm creates weight stigma and weight cycling and healthcare inequality. And then it blames the negative outcomes from that on higher weight bodies. And then it uses those negative outcomes to justify more weight stigma, weight cycling, and healthcare inequalities. And so we've got to get out of that cycle.
Ragen brought up some really good points that hit home for me because we've heard a lot of this same thing when it comes to other people's access to healthcare, minorities, right? We've heard some of those same inequalities when it comes to healthcare, so she makes some very valid points there.
It has to be an equal playing field for everybody.
Yeah.